Hello everyone, my name is Mohammad Asif Alam. Today I will discuss about tirofiban. Tirofiban, a medication widely used in a cardiac care, especially a patient with the ACS, acute coronary syndrome, undergo PCI, when other option may not suffice. Brand name of tirofiban is available in market like Agriblock, Agriban, Tirofiban, Agramed. Tirofiban is a IV antiplatelet medicines, a class of glycoprotein LLB/LLA inhibitors that blocks the final pathway of platelet aggregation that prevents platelet from binding to fibrinogens and forming clot. Tirofiban is a short-acting and rapid-actions antiplatelets IV drugs. Indication of tirofiban: when patients requires rapid antiplatelets effect, NSTMI, STEMI, PCI procedure in a high-risk procedure, and need when a patient is unable to take antiplatelets oral medications, that I'm using tirofiban. When thrombotic lesions are seen in a CAG. Contraindication of tirofiban: internal active bleedings, hemophilia, recent history of surgery, trauma, hemorrhagic bleed, uncontrolled hypertensions, more than 180 ml of Hg, बोल सकते हैं platelet counts below 1 lakh. Dose of tirofiban: loading dose is 25 mcg per kg IV over 3 minutes, and maintenance dose is 0.15 mcg per kg per minute over 18 to 24 hours. In case of renal impairments, when a creatinine clearance is less than 60 ml per minute, in this case, reduce the dose of tirofiban by the 50%. How to administer tirofiban? Before administration of tirofiban, check the vial temperature and always give by syringe pump. Check a baseline data of CBC. Platelet count should be more than 1 lakh, BTCT, PTINR, APTT, and check the IV line is secure or not, and check the history of patients and why tirofiban is transfused to the patient's indication and dose and prescription letter. During administration of tirofiban, check a bleeding. When a patient comes with a PCI, check a sheath, femoral sheath, radial sheath, any bleeding are there or not. Check urine color, stool color, gum bleed, and IV line bleed. Check on neurological conditions, confusion, headache, and a new weakness arise. Check conscious level of patients. When drop, may suggest IC bleed, and stop medicine and inform the doctors. And check CBC or platelet count and APTT monitoring. Check vitals regularly, BP, pulse, and ECG monitoring continuous, and check any abdomen pains may suggest internal bleedings like intraperitoneal hematoma. After administration of tirofiban, don't leave patients alone. Continuous check IV lines, bleeding tendency, delay bleeding tendency, ECG monitoring, vitals monitoring, neurological conditions monitoring, and don't send patient to the washroom, and take always up side rail of the bed. Side effect of tirofiban: hypotension, bradycardia, thrombocytopenia, IV line hematoma, sheath hematoma, retroperitoneal hematoma, and the intracranial hematoma. These are the side effects of tirofiban. Thanks to all of you.